Ozempic, the famous weight loss drug. What is it? Let's find out in this video. What does Ozempic mean? Ozempic, or Semaglutide, is an injectable medicine that people with type 2 diabetes take once a week to control their blood sugar levels. Ozempic is also used to lower the risk of a stroke, heart attack, or death in people with type 2 diabetes and heart or blood vessel disease. Semaglutide, the active ingredient in Ozempic, has also been shown to help people lose weight in clinical trials. However, the FDA has not approved Ozempic as a weight loss drug. Ozempic is used when other medicines haven't been able to control blood sugar well enough. It should be used along with a plan for eating right and working out. Type 2 diabetes is a long-term disease in which the body can't make or use insulin properly, causing the blood sugar level to rise too high. Over time, having high blood sugar can cause serious health problems like nerve damage, stroke, kidney problems, heart disease, and problems with your eyesight. When blood sugar levels are high, Ozempic helps the pancreas release the right amount of insulin. Insulin moves blood sugar from the blood into body tissues where it's used for energy. The Ozempic injection works by slowing down how fast food moves through the stomach. This can make you feel less hungry and help you lose weight. Ozempic is part of a group of drugs called incretin mimetics. Ozempic is a glucagon-like peptide or GLP-1 receptor agonist. It works by binding to the GLP-1 receptor, which is the target of natural GLP-1, and turning it on. GLP-1 is a hormone that acts on glucose in a number of ways. These effects are caused by GLP-1 receptors. This drug can't be used to treat type 1 diabetes or diabetic ketoacidosis, a serious condition that may develop if high blood sugar is not treated. People with diabetes who need insulin are not given Ozempic to treat their condition. So, do people use Ozempic to lose weight? Semaglutide, which is the active ingredient in Ozempic, is FDA approved for weight loss under the brand name Wegovy, but not under the brand name Ozempic. Semaglutide, the active ingredient Ozempic, is also in Wegovy injections, which are given once a week to adults who are obese or overweight and have health problems that are caused by their weight. Patients with type 2 diabetes who also eat right and work out take Rybelsus pills to lower their blood sugar levels. It also has semaglutide. Keep in mind that the Ozempic injection may make you more likely to get a type of thyroid cancer called medullary thyroid carcinoma, or MTC. Semaglutide gives animals in the lab tumors, but it's not known if the medicine makes people more likely to get cancer. Tell your doctor if you or someone in your family has MTC, also called multiple endocrine neoplasia syndrome type 2 or MEN2, a condition that causes tumors in more than one gland in the body. If this is the case, your doctor will probably tell you not to take this drug. If you have any of the following signs, you should call your doctor right away. There may be a lump or swelling in the neck, trouble swallowing, a hoarse voice, or shortness of breath. Keep all of your appointments with your doctor and the lab. Your doctor might want to do some tests to see how the medicine affects your body. When you start treatment and every time you get a refill, your doctor or pharmacist will give you the patient information page from the drug maker. You can get to the medicine guide by clicking this link. How to take the medicine. Read the information carefully and talk to your doctor or pharmacist if you have any questions. Talk to your doctor about the risk of using this medicine. Prior to the use of Ozempic, tell your doctor or pharmacist if you're allergic to semaglutide, albiglutide or Tanzium, which is no longer sold in the United States, liraglutide, also called Saxenda or Victoza, dulaglutide or Trulicity, lixisenatide or Adlixin, exenatide, Bidurion or Byetta, or any of the ingredients in the Ozempic injection. Talk to your pharmacist or read the medication guide to find out what is in the medicine. Tell your doctor if you have or have ever had pancreatitis, diabetic retinopathy, gallbladder disease, kidney disease, or eye damage caused by diabetes. Tell your doctor if you have had diarrhea, nausea, or vomiting in the past few days, or if you can't take liquids by mouth. This could lead to dehydration, loss of a large amount of body fluids. If you intend to get pregnant, your doctor might tell you to stop taking Ozempic 2 months before you want to get pregnant. Tell your doctor if you're expecting or if you're nursing. If you get pregnant while taking the drug, you should call your doctor right away. See your doctor if you notice a big change in your diet, your activity level or weight, or if you get sick, get an infection or a fever, feel stressed out for no reason, or if you get hurt. Your blood sugar and how much medicine you need can be affected by these changes and situations. When you use a semaglutide injection to lose weight, you should know that your mental health could change without warning and that you could become suicidal, which is to plan or try to hurt or kill yourself. If any of the following happen to you, your family, or your caregiver, you should call your doctor right away. Depression, talking or thinking about hurting or killing yourself, pulling away from friends and family, being worried about death and dying, or any other sudden changes in behavior or attitude. Make sure your family or caregiver knows about any symptoms that could be serious so they can tell a doctor if you can't get to the doctor yourself. What's the best way to use Ozempic? Ozempic comes as a liquid solution in a pre-filled dosage pen that's injected under the skin. It's usually injected once a week, at the same time every week, on the same day of the week, no matter what time you eat. You can change the day of the week you take semaglutide as long as it's been 2 days or 48 hours since your last dose. Most likely, your doctor will start you on a low dose of Ozempic and slowly increase it over the course of 4 weeks. In 4 weeks, your doctor may increase your dose again based on how your body reacts to the drug. You can also get an Ozempic shot in your upper arm, your thigh, or your stomach. Change where the injection is given each time. You can give insulin and Ozempic at the same time, but not right next to each other. If you keep the pen in the fridge, let it get to room temperature before using it. Before injecting the solution, it should always be checked. It should be clear, have no color, and be free of any particles. Do not use the drug if it's colored, cloudy, thick, or has solid particles, or if the date on the bottle says it's passed. Read the directions on your prescription label carefully, and if you don't understand something, ask your doctor or pharmacist to explain it. Follow the directions for this medicine to the letter. Do not take more or less of it more often than your doctor tells you to. Carefully read the directions for use that come with the drug from the company that made it. This will tell you how to give yourself a dose of Ozempic by injection. Talk to your pharmacist or doctor if you have any questions about how to inject this drug. This medicine helps to control blood sugar, but it's not a cure. Even if you feel fine, you should still take the medicine. Do not stop taking this medicine without talking to your doctor first. Don't use needles or pens more than once, and don't share them. Always take the needle out right away after giving yourself the injection. Needles should be thrown away in a container that can't be punctured. Ask your doctor or pharmacist how to properly throw away the container that can't be punctured. How does Ozempic make you feel? Ozempic may have side effects that you don't want. Tell your doctor if any of the following are severe or last for a long time: constipation and pain in the stomach, nausea, diarrhea, heartburn, and burping. Some of the bad things that can happen can be very bad. If you have any of the following symptoms, you should call your doctor right away or go to the emergency room. Pain that stays in the upper left or middle of the stomach and moves to the back with or without vomiting, rash, itching, swollen eyes, face, lips, tongue, or throat, trouble breathing or swallowing, less urine or swollen legs, ankles, or feet are signs of kidney disease. Pain in the upper stomach, yellowing of the skin or eyes, fever or feces that look like clay, and a fast heartbeat are all signs of cholera. There could be more bad effects from this medicine. If you take this medicine and start to feel strange while you're on it, you should talk to your doctor right away. Thank you so much for watching this video. Stay tuned for more.